Hi everybody, here are my rules for safe binding and how it affects top surgery. Enjoy! Because there is a lot of confusion out there about binding, about the dangers of it, about how it affects top surgery, all that sort of thing. So I'm just going to get into it right off the bat, and then if we've any time, I would love to answer your questions. So, first of all, when it comes to binding, if you use common sense, you probably are not going to go too far wrong. You don't want to bind at night. That's a no-no. Give your body a rest. So you really don't want to be binding more than about 12 hours a day. Number one. Number two, don't bind when you work out because you need to be able to take nice deep breaths. And as a general rule, when you work out, if you're having trouble taking a nice deep breath or that's causing you pain, you're probably either wearing something too tight or you probably are wearing something too tight. When you take off a binder, have a good inspection. Take a look, and there's things you want to look out for. You don't want to see any broken skin. That means that binder isn't fitting properly or it's too tight. That's not for you. Or probably you're wearing it too long. Same thing, you don't want to see any bruising. That's another no-no. And the third thing is you always want to keep a lookout for rashes, because particularly fungal rashes, such as Candida impetigo, different sorts of rashes can form underneath the breast. And that's not good for you. A lot of patients kind of go around with that chronically. And sometimes you really have to just give up on the binding for a little bit to let that skin breathe and get over it. But if you follow these rules, you're probably going to be very safe. Now, a big thing that people worry about is binding going to mess up my chances of getting top surgery? And I have never in my career looked at somebody and said, gosh, I'd love to give you top surgery, but you just ruined your chances because you bound. It would never stop me. I can't imagine any situation that would stop me from doing your top surgery. However, the one hypothetical scenario I can think of is if you have a very small chest and you're a candidate for keyhole. Potentially, if you were to smush down the breasts and make the nipples point at the floor, if you were to do that enough, you could potentially take yourself out of the keyhole category and put yourself into the double incision category. That's kind of the only scenario I could think of that you would worry about. So if you find yourself smushing them down, that's probably not a good idea if you want to get keyhole in the future. But other than that, I'm not too worried about binding overall. I think people stress a lot about it, but certainly as a surgeon, when it comes to planning the TT or your top surgery, I think there's a little bit too much worry about it altogether. So that's my